Hi, Jamie Spagnolo here in the group Mexican Culture. I want to talk about something we all deal with every day, but don't always think about it. Personal space. This means how close we feel comfortable standing or sitting next to someone, and whether we're okay with things like touching or hugging. We'll look at how personal space works in Mexican culture using a model called the Geiger and Davidsar Transcultural Assessment Model. This model helps nurses, doctors, and other healthcare workers understand how culture affects patient care. One of the 6 parts of the model is space, and that's what I'll be focusing on for the next few minutes. In Mexican culture, people usually feel comfortable being physically close to each other. This is very different from some cultures, like American or Northern European, where people like to keep more distance. In Mexico, being close to someone when talking or greeting them is often seen as friendly and respectful. For example, it's normal to shake hands, give a hug, even a kiss on the cheek when greeting friends or family. People may stand or sit closer than what others might be used to. This closeness isn't just about being physically near, it also shows warmth, caring, and trust. If someone stands far away or avoids touch, it could be seen as cold or even unfriendly. Now let's think about how this affects us in healthcare. If you're a nurse, doctor, or a caregiver working with a Mexican patient, being too distant or formal might feel cold or even disrespectful to them. But standing or sitting a little closer, making eye contact, maybe even offering a gentle touch on the shoulder could help build trust and make the patient feel more comfortable with you. Of course, this doesn't mean you should invade someone's space. It just means you should be aware of how different cultures view closeness and just adjust your approach. Also, things like age and gender matter. An older woman might want more privacy or modesty, especially if the healthcare worker, provider, or nurse is a man. Younger women who have lived in the United States for a long time might be more used to American personal space habits. Everyone's different. It's important not to assume. So what can we do as caregivers? We can start by being friendly and respectful. Watch how the patients react to us. If they lean in or seem relaxed, they're probably okay with being close. If they step back or seem uncomfortable, give them more space.